Hello and welcome. My name is Dr. Shanai, and this is my health blog, direct from doctor. So my today's topic is idiopathic pulmonary fibrosis. Say a few days ago, the famous tabla maestro Zakir Hussain, he passed away, and the cause was this. The cause was he was suffering from idiopathic pulmonary fibrosis. So pulmonary means is something to do with the lungs, and fibrosis means scarring. The tissues getting stiff and hardened, the soft tissues becoming hard, scarring and becoming hardened. So that's called as fibrosis. Fibrosis is very dangerous for any organ, soft organs. And idiopathic means no cause known yet. The doctors haven't found any cause yet. In science, there is no particular cause for idiopathic pulmonary fibrosis. So there are certain conditions called as silicosis, asbestosis, because of the inhalation of the cement particles and inhalation of the silica particles and such kind of things, which are very popular. But there is a cause for that, right? That also can cause fibrosis, and that also can cause lung cancer. So that's the reason we have to stay clear of those cement particles, asbestos particles, silica particles, and all that as far as possible, as far as is permissible. But idiopathic pulmonary fibrosis, so far the scientists have not found any cause. Why? That's the reason it's called as idiopathic. Idiopathic means without any known cause. That is called as idiopathic. Fine. Idiopathic pulmonary means something to do with the lungs, and fibrosis means scarring, the soft tissue getting hard. So in lungs, what happens is you should know the structure of the lungs first. Please refer to the picture what I'm putting here. The lungs, the main stem of the lung, so that is called, there is something called as the main stem from which descends from the trachea, and it branches into bronchi. There are two bronchi on two sides, one bronchus on left side and one bronchus on the right side. These bronchi again branch into bronchioles. We call it as bronchioles. It's exactly like a tree structure, like the branches of the tree, the main branch of the tree and sub branches of the tree. Similarly here, from the trachea, it comes down and it branches into bronchi, one bronchus, another bronchus, and those bronchi, they go on, branching into the smaller, the minute branches called as bronchioles. And at the end of these bronchioles, there is something called as alveoli. One alveolus, one single thing is called as alveolus, multiple is called as alveoli. So these alveoli are very soft ball-like structures, so which aid in absorbing the oxygen, sending it to the blood, and to the bloodstream. It goes into the heart, gets pumped into the various cells, and all these things are it reaches the circulatory system and supplied to all the cells, and other effluents like carbon dioxide and other gases on the other waste things absorbed moisture from the blood, and it's sent out through the lungs, right? So these alveoli, they are the main things which have this function of absorbing the oxygen and supplying the oxygen. So that so if these alveoli get hardened, just imagine what will happen. These are soft tissues, okay, soft end tissues of the lungs. So these get hardened, it becomes really hard. So once it becomes hard, it can't function anymore. It's stiff like a rubber, okay. It can't function anymore. So the scarring will take place. It may be a small portion of the lung, or it may be larger portions in the lung which get hardened, which undergo the fibrosis. And once a fibrosis happens, there is no way it can come back to the original form. It doesn't come back. It cannot. So that is the problem with the fibrosis. Fibrosis is irreversible. It cannot be reversed. So what happens is the oxygen exchange, it comes down and down and down. It may be slowly progressing, it may be fast progressing. It depends on the particular person. So scientists haven't found out why it happens, but they have found out at least a genetic link. Means some ancestors in the family might have suffered the same thing, that might be passed on to the next generation, not immediate generation, the next generation or something. So those are all called as genetic factors. Genetic factors. Uh, some scientists suspect that it may be because of smoking. Smoking can cause, but still it's not proven yet, whether these things are the really the factors which actually cause this idiopathic pulmonary fibrosis. Very unfortunate, in fact, actually. Without any person's fault, it can happen. A person who is leading otherwise a very, very healthy life can have this. Of course, it's not very rampant, it's not very common, okay. So, a few persons in the world suffer from this, and unfortunately, this particular person, this gentleman Zakir Hussain, who was a fantastic tabla player, or so famous all over the world, he died because of this. Doctors could not do anything, they cannot do anything. So when it progresses, some doctors have tried lung transplant. So lung transplant, section of the lung is removed, and transplantation is done from another person, a healthy person. So that is whom I have. So this lung that I'll talk in the future. These transplants, how they are done. So this transplant, it may work or it may not work. In most of the persons, rejection tendency is more. See, the transplant, what happens is there is something called the host, the donor, and also the recipient. The recipient's system may reject the transplant, or may reject it. So in the lungs, it's very, very difficult. Kidney transplants usually stay most of the times, but lungs, very, very rarely it stays. It gets infected very, very easily. Once if the infection occurs, the person has to be really careful about the infections after the transplant. So infections may occur, and the person can succumb to that too. If the infection, this person will be always immunocompromised. Immunity level will be low. So this is it. So the main problem what the person feels with the idiopathic pulmonary fibrosis, the symptoms I'm talking about is breathlessness, lassitude, and weakness, terrible weakness because of lack of oxygen in the tissues. Okay, lack of oxygen, and the fingernails may become clubbed. We call it as clubbing because of the lack of oxygen reaching the area. So total lassitude, and joint pains, and several symptoms which are associated with the lack of oxygen. All these symptoms the person can face. Okay, and pain in the chest region can occur. All right, and in the worst cases, the thing may proceed to become lung cancer also. Okay, the direct linkage may not be there, but the thing is, it can go into the cancerous situation. So these are some of the problems. What the treatment, doctors have tried, research is on how to treat this kind of problem, but because the cause is not known, the treatment also suffers. The doctors have tried a couple of medicines, which I cannot tell right now, because it's out of the scope, because the doctors have to do it. The doctors who are treating, they have to tell exactly what medicines that may be having some kind of a small effect, maybe or may not be. Research is on. And oxygen therapy, like the patient will be put, if the problem is very severe, the patient will be kept in ventilator, and oxygen therapy will be given, right? Oxygen mask, so that hyperbaric oxygen therapy, and so many things have been tried. So ultimately what happens right now, what's happening is, until a proper cure is found out, the chances of a person surviving is very, very bleak. It's very, very less. Scary picture, but not to worry, everybody doesn't get this kind of a thing, because if a person gets, it can be very slowly progressing also, and most of the times the persons who are aged, they get more. this kind of a problem. All right. So this is something I wanted to talk today. Just a little information about idiopathic pulmonary fibrosis, because most of the people who know about the death of this particular gentleman, Zachary Sin, may have heard about this disease. So some doubts may be there in some people's mind, so I wanted to clear that. So see you in my next video. Until then, take care, stay healthy, and please don't forget to subscribe to my channel, and also tap the bell icon to get the notifications for the future videos. And also please ask your friends to become subscribers, and please share this video as much as possible through your social media or WhatsApp or whatever, okay, so that I'll be encouraged to make more videos. Thank you very much for being with me. Take care. Bye.